Hi, I'm Elizabeth Robinson. I've been a nurse since 1986. I have a master's degree in nursing, and I have a PhD in mythological studies with emphasis in depth psychology. When I was looking at topics for my dissertation, the nurse chose me. I had to write about the nurse. I've always been a nurse's nurse. I consider myself a nurse's nurse more than a patient's nurse, and I just love teaching about the nurse, and I am very passionate about the profession and the image of the nurse. I do not have answers to questions, but I love to bring up questions, and I love to hear from students what their impressions are, how they might relate to some question, or what kind of answers they have. I learn as much as the students learn every time I teach. Whether you're a nurse or not, you'll learn a lot about the nurse's role and the nurse's image, the historical significance, the cultural significance, and what's going on today in healthcare. You'll learn how to collaborate better with nurses, and you'll learn how to understand and have compassion for your colleagues. You'll also learn some pretty profound things about yourself. If you're a nurse in burnout, or you're a nurse who is just tired, or you would just love to learn more about the role of the nurse, the image of the nurse, or if you're just curious about the nurse in general and you're not a nurse at all, it would be really fun to have you in the class as we look at the nurse image from prehistoric times through modern day and explore what all of this means and what it means to today's nurse in healthcare. So please come join me and we'll have a great time in this class.